The whole neck is divided into two triangles. One is anterior, one is posterior. By a muscle which takes origin from the sternum and from the clavicle, and it goes up to the mastoid process of the occipital bone. That means sternocleidomastoid muscle. This sternocleidomastoid on either side divides the neck into anterior part, that is the anterior triangle, and the triangle which is present behind, that is the posterior triangle. So the limit of the anterior triangle is by the sternocleidomastoid, that means below and posteriorly, and this is the mandible, this is the base of the mandible, and this is the angle between the ramus and the base. From here, if we draw another line up to the mastoid process of the temporal bone, the mastoid process of the occipital bone, so then this is the another side of the triangle. So this is the upper limit, and the anterior limit is the midline up to the suprasternal notch. So there are two triangles on either side of the neck. Now this anterior triangle, you can see it here. This is the limit. In the midline, this is one limit. Posteriorly, this is by the anterior border of the sternocleidomastoid. Above, by the base of the mandible, and from the angle of the mandible, a line drawn up to the mastoid process. So this is the anterior triangle, and this is the posterior triangle. Again, this anterior triangle is subdivided by two muscles. One is omohyoid muscle, and another is the digastric muscle. Omohyoid muscle, it takes origin this is the suprascapular notch. From here it is taking origin and it is going medially up to the hyoid bone. So this is the omohyoid muscle, two muscles on either side. It is continued up to the hyoid bone, omohyoid muscle. And another muscle from the digastric fossa of this mandible, this goes up to the mastoid process of the temporal bone. That is called digastric muscle. We can see this is the digastric muscle we can find, and we can find this is the omohyoid muscle, which originates, this omohyoid muscle originates from the suprascapular notch of the scapula. So, in this figure, we can find this is the omohyoid muscle and this is the digastric muscle. Again, this omohyoid muscle and the digastric muscle, they have got two bellies. This is the anterior belly of the digastric muscle. This is the posterior belly of the digastric muscle. And in between we get a central triangle, which is attached to the hyoid bone. Similarly, the omohyoid muscle, it has got superior belly and one inferior belly, and in between we get a central triangle. So, this digastric muscle and the omohyoid muscle divides the whole anterior triangle into several other sub-triangles. One is above we are getting in between the bellies of digastric muscle and the lower quarter of the mandible and the imaginary line from the angle of the mandible to the mastoid bone. So we are getting one triangle which is called digastric triangle because the name is related to the muscle, digastric muscle. So we are getting the digastric triangle. Similarly, we can get another triangle below. We can get this digastric triangle above. Another triangle we can get here, which is bounded anteriorly and above by the posterior belly, anteriorly and below by the superior belly of the omohyoid, and posteriorly by the anterior border of the sternocleidomastoid, which is a very important triangle which is called carotid triangle, where we can get the carotid arteries. Carotid artery is a common carotid artery. We know it is left common carotid artery is a direct branch from the arch of aorta, while on the right side the common carotid artery originates from the brachiocephalic trunk of the arch of aorta, which divides into right common carotid and right subclavius. So, whether it is right common carotid or left common carotid, it divides at the level of the upper border of the thyroid cartilage. This is the Adam's apple. This is the prominence in the neck, which is caused by the thyroid cartilage, which is very much prominent in males. In the upper border of the thyroid cartilage, that artery gets bifurcated into external and internal. External remains medially and internal remains laterally. There is no branch in the neck of which artery? There is an internal carotid artery has got no branch in the neck, whereas the external carotid artery, which remains medially, it gives so many branches. We will know. So carotid artery, it is a carotid triangle is named as per its the location of the carotid arteries. So that is important one. And another triangle we can get in the middle of the neck, which is formed by the superior belly, posteriorly by the superior belly of the omohyoid and the anterior border of the sternocleidomastoid, and in the midline, that is nothing but the midline of the neck. So this is the area where we can get some strap muscles, like from the sternum to the hyoid, sternum to the thyroid, sternohyoid, sternothyroid, from the thyroid to again the hyoid bone, that is the hyoid muscle. That means all these infrahyoid muscles. There are suprahyoid muscles. This is the above the hyoid bone. We can find this is the hyoid bone. This is the greater cornu, and this is the body. And we can also get an impression of the thyroid cartilage. Below the thyroid cartilage, we can get cricoid cartilage, and here we can see the thyroid gland, the isthmus of the thyroid gland. So this is the area. This is the area where we get some strap muscles which originates from the sternum. Either it goes up to the hyoid bone, or it goes up to the thyroid bone, the hyoid bone, or it goes to the thyroid cartilage. So sternohyoid, sternohyoid, and from the thyroid cartilage to the hyoid bone, that is the thyrohyoid. So that triangle is called muscular triangle. The muscles are present, and also we can get the lower part of the larynx and upper part of the trachea, lower part of the pharynx and upper part of the esophagus. So that area is related to some muscle. So this triangle is called the muscular triangle. This area. So posteriorly, above and posteriorly by the superior belly of the omohyoid, above, below and posteriorly by this anterior border of the sternocleidomastoid, and medial limit is the midline of the neck. So this is the muscular triangle. Another triangle we can get on either side. We can see it in this figure. This is the midline of the neck. This is the mandible. This is the hyoid bone. And on either side, we are getting the superior, anterior belly of the digastric muscle, and below we are getting the hyoid bone. So we are getting two triangles on either side. That is, they are called the below the mentum. This is called the mentum, where this area of the mandible is called the mentum. So below the mentum, so this area, this triangle is called submental triangle. So we get so many triangles. One is digastric triangle. This is the submental triangle. This is the carotid triangle, and this is the muscular triangle. So there are 4 sub triangles in the anterior triangle of the neck. And we can see their boundaries, their flow, formation of flow, and the contents. One by one, in short, this is the submental triangle we can get. Okay, so above, it is bounded above by the mentum or chin, below by the hyoid, on either side by this anterior belly of the digastric. So this is the boundary. And in the floor we are getting, we can see one muscle. We can see one muscle. That muscle is from hyoid bone and up to the mandible, which is called mylohyoid. There is a mylohyoid line we can get in the mandible from here. This is the mylohyoid line on either side, from here to the hyoid bone, one muscle, mylohyoid muscle. And it forms an oral diaphragm. It forms an oral diaphragm, which is called diaphragma oris. Oris means opening of the mouth. So it forms a diaphragm, it looks like a diaphragm. So it's called diaphragma oris, or the mylohyoid muscle. And over which we can find in the midline one vein, that is the anterior jugular veins, and over which we can find some arteries. Okay, we can find some arteries, which is called mylohyoid arteries, and over which we can find one nerve, which is not visible here, which supplies the mylohyoid muscle, which is called nerve to mylohyoid, which is not visible in this figure. It is coming from the mandibular nerve, sub-branch from the mandibular nerve, which ultimately supplies this muscle and the anterior belly of the digastric muscle. Just remember the nerve supply of anterior belly and posterior belly of the digastric muscle is different. Anterior belly is supplied by the mylohyoid nerve, which is coming from the inferior alveolar nerve, which is again a branch from the mandibular division of the trigeminal nerve. That means this anterior belly is being supplied by the mandibular nerve, whereas the posterior belly is being supplied by the facial nerve. Why? The anterior belly develops from the myotome of first brachial arch, whereas the posterior belly, it develops from myotome of second brachial arch, whose nerve supply is facial. So anterior belly is being supplied by the mandibular nerve, more precisely the mylohyoid nerve. So again, I am going to the contents. We can find several lymph nodes below the chin. They are called submental group of lymph nodes. Then we will get mylohyoid nerve to mylohyoid, which also supplies the anterior belly and which also supplies. Okay, I will just leave now. Next is the digastric triangle. We can see this is the digastric triangle. So we know the boundary anteriorly and inferiorly by the anteriorly, posteriorly and inferiorly by the posterior berry of the digastric, and above by the base of the mandible and up to angle up to the mastoid process of the temporal zone. We can imagine one line. So this is the digastric triangle. This is the central tendon of the digastric muscle, which is attached to the hyoid bone at the junction between the body and the beta cornu of the hyoid bone. Now, the floor. Floor is formed by, we can see the same muscle that is the mylohyoid muscle. In the floor, we can get the mylohyoid muscle and also other muscles which are not visible, that is the hyoplexus muscle and the middle constrictor muscle. Now, these are the contents which we can find in the digastric triangle. Here we can find one very important salivary gland. Actually, the superficial part of the submandibular gland. So this submandibular gland, which is just present below the mandible, it has got superficial part and one part is inside, that is the deep part. So superficial part of the mandibular gland we can find which occupies or which is present within this triangle. Another contents we will see in the cadaver, until we see the cadaver, it is very hard to digest. We can find the hypoglossal nerve, we can get the facial artery, we can get from the one branch from the facial artery, which is called going to the main term, which is called submental arteries. So these are some contents. And within the triangle, remember we can find 9, 10 and 11 cranial nerve. 9 cranial nerve is glossopharyngeal. 10 cranial nerve, vagus. 11 cranial nerve, spinal accessory. Why it is called spinal accessory? What is the difference between spinal and cranial accessory? Can you tell me? Can anybody tell me what is the difference between spinal accessory and the cranial accessory? At least one difference.
So cranial accessory comes out from the jugular foramen, and spinal accessory comes out from the foramen magnum.
And regarding its nerve supply, its supply. Spinal accessory supplies yes. Carotid Triangle. Cranial accessory supplies accessory to the vagus. So it goes along the branches of the vagus and it is supplied pharynx, palate. Okay. So we can find 3 cranial nerves, 9 cranial nerves. That is glossopharyngeal, 10 cranial nerve, that is Vagabond's nerve, that is the vagus. It starts from the cranium is the whole of the viscera of the thorax and abdomen, and up to the junction of lateral puncture and medial puncture of the transverse colon. And parasympathetic nerves, parasympathetic nerves. Okay. So we can get so many these three nerves, 9, 10 and 11 nerves, which are also visible in this triangle. Now we can find the division between external and internal carotid. And in between, we can find one structure code, that is the styloid process of the temporal cone. So that is also we can find here in the digastric triangle. So this is the boundary of the digastric triangle. In this figure we can see this is the lower boundary, this is the upper boundary. This is the myloid, and we can find the middle constrictor muscle. Most important triangle, whatever you can forget, but you should not forget this triangle, that is the carotid triangle. So it is boundary posteriorly by the anterior border of the sternocleidomastoid, this is the posterior limit, anterior border of the sternocleidomastoid, and anteriorly and superiorly, that is the posterior belly of the digastric, anteriorly and inferiorly by the superior belly of the omohyoid muscle. So this is the carotid triangle. And within the floor, we can get one muscle from hyoid to hyoid, hyoid. One muscle which is transversely oriented from this is called the hyoid cartilage, and there is one oblique line from here it takes origin and it goes to the pharynx, that is the inferior constrictor of the muscle, inferior constrictor, and the middle constrictor we can get. So these forms the floor. And which is the roof? Roof we can find skin, superficial fascia, then the deep fascia, which is called the investing layer of the deep cervical fascia. So that forms the roof. Okay. So this dotted line shows the position of the carotid triangle. So here we can get the middle constrictor, here we are getting the inferior constrictor, and we are getting the thyroid muscle. So this forms the floor of the carotid triangle. Now this figure shows the content of the carotid triangle. And this is the magnified figure, and here we can find the common carotid artery which breaks into two divisions, which remains laterally, which is called the internal carotid, and one is external carotid. So external carotid artery within the neck, it gives so many branches. We can see so many branches. Okay. So within the carotid triangle, we can see these branches. This branch is going to supply the thyroid gland from above. So it is called superior thyroid artery. This is coming from posterior part of the carotid, external carotid, which is called the ascending pharyngeal artery, and it supplies the pharynx. So there are several branches of external carotid artery which we can detect in this triangle, that is the carotid triangle. The first branch of the external carotid artery, previously we used to call the first branch is the ascending pharyngeal artery. Okay, but after dissection of several cadavers, now this superior thyroid, we are in favor of the superior thyroid. So, which one is the first branch? This is the superior thyroid. Previously, it was said that is the ascending pharyngeal. Okay. So, this is the superior thyroid, then ascending pharyngeal. Then another artery we can find which forms a loop and it goes to supply the tongue, that is the lingual artery. Then is the facial artery, and these are some branches from the posterior border, that is the occipital artery, from the posterior auricular artery, and ultimately it goes above and divides into maxillary artery and superficial temporal artery. We can find this is the digastric muscle along with, okay, this is the area of the digastric muscle. Okay, we can find the thyroid ligament and glossopharyngeal nerve along with its supply, that is the thyropharyngeus muscle here. So this is the area of the digastric triangle, and below this is the area of the carotid triangle. So within the carotid triangle, we can get so many branches of the external carotid. So within the carotid triangle, we can get not only the external carotid, we can get the internal carotid, which remains lateral to the external carotid. And most laterally we get this vein, which is coming from above, from the cranium. Within the cranial cavity there is one vein which is called transverse sinus, then sigmoid sinus, which is continued as where it passes to the jugular foramen. Posterior part of the jugular foramen, which is present in the occipital bone, that vein is called internal jugular vein. So this internal jugular vein, and another vein is coming from the superior extremity, that is called subclavian vein. So internal jugular vein and subclavian vein ultimately joins to form brachiocephalic vein. And brachiocephalic vein on the other side will join and forms the superior vena. So this is the vein which is coming from the cranial cavity. And where it terminates? It terminates after joining with the subclavian vein to form the brachiocephalic vein. So this vein we can get most laterally. That is the internal jugular vein. Most lateral side. And we can find there are two bulbs which are present. That means two swelling. One swelling is above and one swelling is below. They are called superior and inferior bulbs of the internal jugular vein. This inferior bulb we can get in between two heads of the sternocleidomastoid muscle, where we actually perform the central line in ICU. In intensive therapy unit or care unit, we perform one central line, because if we perform the venous line, that is the peripheral venous line, at one moment of time, 1 or 2 days, it becomes clogged. So it will be of no use after 2 to 3 days. So in that case, continuously we have to put the central line that is created on the internal jugular vein. And this, in between two heads of the sternocleidomastoid, we get the inferior bulb of the jugular vein. So within the carotid triangle, we can get all the corresponding. This is the artery. We can get the corresponding vein. That means, if it is superior thyroid artery, we can get superior thyroid vein. Similarly, we can get lingual vein, we can get facial vein, so many veins, and those veins ultimately drains into the internal jugular vein. So here, within the carotid triangle, we can get facial vein, we can get lingual vein, we can get superior thyroid vein, occipital vein, posterior original vein, all veins we can get, and ultimately we can see that those veins ultimately drains into the internal jugular vein. It will not, the vein will definitely drain into another big vein, not in the artery. Vein drains into the artery or the vein? Vein. Another thing we can get, this is the 10th cranial nerve, which is present in between the common carotid and the internal jugular vein. So this is nothing but the vagus nerve. So what are the contents of the, so as a whole, we can get common carotid, which divides into external and internal. We can get internal jugular vein. All these structures are being covered up by one sheath. Nature has provided one sheath, which is coming from you will know that when we learn the deep cervical fascia, it has got investing layer, pretracheal layer and prevertebral layer. So ultimately they are coming from the pretracheal and prevertebral layers, and it forms a sheet around the carotid arteries and internal jugular vein. That is called carotid sheet. That is called carotid sheet. So the carotid sheet actually covers this common carotid, external, internal, and this internal jugular vein. And also it covers this nerve. So we can get, what are the contents of the carotid sheet? Common carotid, which divides into external and internal carotids, and also we get the internal jugular vein. In between and behind we will get vagus nerve. In the cadaver we will find that vagus nerve in between and behind. And more dorsal to this carotid sheet, if we open the posterior wall of the carotid sheet, we can find the sympathetic triangle. Sympathetic triangle. Okay. So, contents, what we can get? The carotid sheet. And carotid sheet means the sheet which covers these arteries and veins. And around the covering, that means on the anterior aspect of the covering of the carotid sheath, or just anterior to the carotid sheath, we can get a necklace of nerve. The necklace of nerve, which is being contributed by this hypoglossal nerve. You can see this is the 12th cranial nerve, which is going to supply the tongue. This is the hypoglossal nerve. From there, a necklace of nerve we can get. Or it forms a loop, which is contributed by this hypoglossal nerve, and it is contributed by C2 and C3, that is cervical nerve. Actually, the contribution is nothing but the C1 nerve, which is passing along with the hypoglossal nerve. This is the C1 and this is the C2 and C3. And this loop of nerve, which is present just in front or within the or embedded within the carotid sheath, that is the ansa cervicalis. Ansa cervicalis. So this is called descendant hypoglossal and this is called descendant cervical. So this two component forms the ansa cervicalis. So in neck dissection in the carotid triangle we get the loop of nerve, which is called ansa cervicalis. So these are the components. Now about the muscular triangle, which is present in the midline, we can find in the midline, lower limit is the suprasternal notch of the mammalian sternum, and above it is by the hyoid bone, and posteriorly we can get the omohyoid muscle. We can get the superior belly of the omohyoid and also by the anterior border of the sternocleidomastoid. So this is the muscular triangle, because two strap muscles we can find from sternum to the hyoid, sternohyoid. And if we dissect the sternohyoid, we can get this sternocleidomastoid and hyoid muscles. All these muscles, they are infrahyoid muscles because below the hyoid bone, and they are being supplied by remember, by this loop, which is called ansa cervicalis. So nature has provided this loop purposefully to supply all these muscles. Okay. Like that. So infra higher group of muscle means one muscle you can see. This is the superior belly of the omohyoid. You can find the superior belly, sternocleidomastoid, sternohyoid, and hyoid. So these are the muscles which are being supplied by the ansa cervicalis. So here we can find another thing. This is the hyoid cartilage, and below we are getting the somatic tracheal veins. That means the trachea. So within the muscular triangle we can get the lower part of the larynx and upper part of the trachea. And lateral to that and posteriorly we will get, and just posterior to it we will get the esophagus. And in between we can get In between esophagus and the trachea, we can get one very important nerve, that is the recurrent laryngeal. So this is the ansa cervicalis. This is the hypoglossal nerve, group of the hypoglossal nerve, through which the C1 component from the cervical region comes, which is called descendant hypoglossal. C2, C3 forms the another group, which is called descendant cervical. So this supplies all these muscles, that is superior belly of the rhomboid, sternocleidomastoid, and inferior belly of the rhomboid. So remember, this is ansa cervicalis, which often comes in your examination. So this is the external carotid artery. We can see the branches. So many branches from the external carotid, no branch from the internal carotid in the neck. Superior thyroid, lingual, facial, ascending pharyngeal, occipital, posterior auricular, and the terminal branches are maxillary at the superficial jugular.